Welcome to the Inspired Living with Autoimmunity podcast, the podcast for high achievers who want to stay sharp, focused, and full of energy despite their diagnosis. With your host, National Board Certified Functional Medicine Health Coach, Julie Michelson, where Julie helps you take your power back from autoimmunity. And now here's your host, Julie Michelson.
Welcome back to the Inspired Living with Autoimmunity podcast. I'm your host, Julie Michelson. And today, Dr. Tami Meraglia joins us, and we have some fun, hot topics to discuss. Dr. Tami is the producer of the docuseries, The Healing Secret, the author of the nationally best-selling book, The Hormone Secret, and the CEO of Vitality Hormone Clinic in Seattle, Bio-Renati Stem Cell and Regenerative Center in Puerto Vallarta, Mexico, and the Seattle Stem Cell Center. In today's conversation, we talk about getting rid of the four-letter word fine, and also the three pillars that are essential for resilience. Dr. Tami highlights the importance of an often overlooked hormone for women, and we answer many questions about the use of semaglutide for weight management and anti-aging. Dr. Tami, welcome to the podcast.
Thanks for having me. I'm so excited.
I am so looking forward to our conversation, and I just had to cut us off and say, wait, I should hit record because I wanted to dive in. I got a little ahead of myself. So I would love to, for listeners that aren't familiar with you, have you share a little bit of your story of how you got to be practicing this kind of medicine, because I feel like most of the things, if not all of the things that you do, are cutting edge and definitely right up my alley.
Well, the good thing about going to medical school when you're older is that you do not swallow all the Kool-Aid. I did not believe everything that I was told in traditional Western medical school. So I danced professionally in a ballet company for many years. And then I went to undergraduate and thought, oh, I'll be a physical therapist. That was the only profession I had ever been introduced to.
Interesting.
Yes. And I got, frustrated with that. As I explored it, I thought, oh gosh, I really want to have a bigger impact. And so anyways, long story short, you go to undergraduate, and when you love anatomy and when you love chemistry, and you end up with a pre-med degree. And so long path to med school, and I chose traditional medicine, and I love the science. I love the cynicism. I love the statistics. I love the data. But all along, I had been interested in herbs and nutrition and, keeping our bodies healthy on our own. I believe we can be the CEO of our own health, and should be, and that doctors and practitioners work for us. And so as soon as I finished, I went in and studied and got certified in naturopathic medicine as well. And so it was really because my patients kept coming to me over and over and over again, and they'd say, I don't feel well. I don't have my energy, and things aren't as joyful, and I'm not sleeping as well. And I have, 15 to 50 pounds that just won't budge. I'm using the same tricks that I used to. I would run the usual tests, right? Thyroid, and check for anemia if they're tired. And I would tell them they were fine. And that's when I realized that fine is a four-letter word. And nobody wakes up in the morning and says, gosh, today I want to feel fine. We want to feel fabulous. So looking at the blood work and looking at how traditional medicine was set up, it's really designed to treat diseases and conditions. And even our wellness appointments are designed to find diseases and conditions at early stages. It has nothing to do with wellness, nothing. So that was really my motivation to dive into what we now call functional medicine, which I think of as a blending of Western and Eastern and naturopathic medicine. So I have my foot on what is needed for the patient because they're the epicenter.
I love that. That is amazing. And I also love that fine, the word fine is banned in my home. It is a 4-letter F word. And so it's like, no, we're all educated. We can find a different word to
Yep.
actually express what we mean. Because fine can be good, it can be, I'm pretty good at least, or fine could mean, I'm terrible and I just don't want to burden you with that. So no, not allowed. Be specific.
Awesome.
Yeah.
That's great.
I love that. So you mentioned, I'm just curious, I don't know this part of your story, but you mentioned, from the ballet background, and you had pretty much you were, which is a good thing that, physical therapy, it makes sense you would have probably plenty of experience with physical therapy. Was there any piece of kind of your own healing journey that aside from just the general interest in, hey, the body can heal and wellness is a thing, that you weren't finding in Western medicine?
Well, two stories. One is my father was diagnosed with COPD, emphysema, and when he got oxygen, that's the beginning of the last chapter. There is no more. So I dove into the research, like I just, so the brain of a doctor and the dedication of a daughter. So
Yes.
that's a really intense
Goosebumps.
motivation.
Yeah.
And I kept bumping into stem cells over and over and over and over and over. And long story short, I was so blessed to be able to participate in stem cell medicine. And now I get to help patients with the holistic part of their program, the hormones, inflammatory markers, when they go to a clinic in Puerto Vallarta. But my dad was able to get off oxygen.
Wait, what? Right? The body can heal? So how come nobody gets off oxygen once they're
And
on it?
stem cells are like everything else in medicine. They don't always work for every person every time. We don't even know why, but an aspirin doesn't either.
Right.
And there's definitely need for, rigorous clinical work. And so I'm excited to see the future. And I'm excited that, places like the clinic in Puerto Vallarta, it's called BioRenati, that I get to be a part of that. And I believe that stem cells are like seeds and our bodies are like soil. And so I get to play in the soil, in the sandbox with everybody and up level that quality. You just have to plant a seed in the sand versus, a rich topsoil full of worms kind of dirt. And you can see the outcome is quite different. So that was one aspect of like, oh my gosh, that is
a whole nother world.
Mm-hmm.
Yeah. I want to get to the second story too, but I love, you mentioned, and not everything works for everybody. We are unique. We are all unique. As somebody who has had a stem cell treatment for the kind of little remainder autoimmune symptoms that I had, my results were remarkable. I had done all of that work, the cleaning it up, the lifestyle, the hormones, all of the things. And so I really love that you're highlighting, there is no magic. Everybody wants that magic cure or solution, but that I love that you're bringing the necessary piece, because I would imagine doing a stem cell treatment on somebody who has I'll call it a dirty lifestyle, probably isn't going to do much. It would be like planting a seed in the sand, I would think.
Yeah, I tell my patients that if they're not willing to like quit smoking or give up alcohol or change their diet and they want to spend the money, now granted, when you go to Mexico to this private hospital, it's a lot less than you would spend here, and you get way more, but it's still a lot of money, right?
Right.
If you want to waste that much money, you could just donate it
or go on vacation. I love that.
Yeah, you've got to. It all works together. So my philosophy of health is that we have really 3 pillars, and one pillar is structure, And I think that stem cells represent a unique potential for fixing structure and problems without turning to drugging and cutting first. We don't know why it works. We don't know when it works. We don't know a lot, but I think it's really exciting. The second thing is chemicals, and our hormones are chemicals, and our nutrition is chemicals. And if you think of that on our outside of our body, there's a lot of toxins and chemicals outside, like pesticides and things like that as well. And the third thing that I don't think is talked enough about, either in naturopathic medicine or at all in traditional medicine, is frequency, energy. And every cell in your body has an electrical current. And if you can change the electrical current, you change the environment of the cell and you change the function of the cell. You change what it is and isn't doing easily. And so if you have all three pillars, you are resilient, right? That is our absolute goal, is resilient. We don't want to be strong like an oak tree, and then when a big storm comes, we crack. We want to be able to shift and respond. If you only have two, then it only takes a job loss, a relationship loss, or a worldwide pandemic to have you feeling sick or actually even get a disease or diagnosis. And if you only have one pillar intact, you probably already have a disease or diagnosis. And so we approach all of our patients from this 3-pillar way of health to optimize, not look for just problems, but how can we optimize it? If you don't have gut problems, I still want to know what's going on in your gut microbiome. It's going to take a while to accumulate at the cell and feel it as a symptom. So why don't we find it earlier? Well, if you don't look, you don't know.
Right.
So that's my journey. And, people will say, oh, you're a very strange MD. You talk about meditation all the time. And, and my colleagues, they say, like, you practice in a parallel universe, like an alternative universe.
You are what we call ahead of the curve, I would say.
Yeah.
You've never shocked me other than, that you're just already to, doing it all so well. Like you're normalizing what we really need to be addressing. And I love that.
And it needs to be normalized, but it also needs to be prioritized.
Yes.
I tell patients, if your meditation doesn't have an appointment time on your calendar and you tell me it's a priority, I'm going to say, liar, liar, pants on fire. Everything that's important is scheduled. You can't just wait until you have enough time, energy, or whatever.
That's the time part's going to be when you're down because you're sick. Energy, maybe not, but it is amazing. And so I diverted you away from, you said you had another kind of story that brought you in this direction to be practicing.
So I was older when I went to residency, having danced, in a ballet company for a long time. So I was pregnant in my first year of residency.
Oh, wow.
And then I was pregnant with my second child in third year residency.
Oh my goodness.
And after that, when my babies were born and, I was so tired, I literally would lay down on the floor between patients. I thought, oh, of course I'm exhausted. I have a toddler, I have a baby, I'm a doctor, I'm a resident. Don't women do that a lot? Like
doctors do it a lot. Of course you're tired.
Women,
you're a new mom. Like, no, we know the difference of, I have to lay on the floor and boy, I really need to get a better night's sleep tonight. They're not the same.
Not at all. Not at all. So I ran my own blood tests and hormones, and, I had been enough of time not pregnant to have quote unquote normal hormones, and everything came back fine. And
there's that word.
I know, right? I had run the usual estradiol, progesterone, thyroid, iron, CBC, liver, all of that stuff. But I hadn't run testosterone.
Ooh.
Hadn't.
That would have been weird.
Right.
Yeah.
Why would, that's for guys. Why would I need or want to even take testosterone? That's scary. I'll get hairy and angry and big muscle. Yucky. Anyways, I ended up, for some reason, I just decided to dive into the research again and find out about testosterone. And what I learned is that women actually have a small amount of testosterone in our bodies. It's actually more than you think, but that's another story. But it has an outsized role in how we look, feel, and function. And so when I tested it, and it's really important to make sure you test your free testosterone, because your total testosterone is like how much hormone is. So if you're going to make a house, you need workers. And total testosterone is checking how many workers are in the truck. Are they working?
I like that.
No, they're not working. Free testosterone is checking the workers that are in the house with a hammer, moving around.
Not just the ones on the payroll.
Right.
The ones actually working.
Exactly.
Yeah.
So my free testosterone was undetectable.
Oh, no wonder you were laying on the floor.
And so I researched all the ways that I could reboot my own biology to get my own body to make its testosterone. And it worked a little bit. But what I found is that because of my age and because of my lifestyle at that time, I was in such severe adrenal fatigue, and my adrenal glands were responsible for making the majority of my hormones, because Mother Nature was inviting me to exit stage left of the reproductive theater. And I decided, okay, I'm going to take 1 milligram of topical bioidentical testosterone, and
life-changing.
It was like within a week.
It's one of my most favorite things about hormone therapy is it's not like, oh, we'll know in a few months like if this is working or when you're optimal. And so I love this whole conversation. I'm so excited because you touched on in your own journey this. I get it all the time. Women are afraid of testosterone. We just have been trained that that's a male hormone. And, then I don't know. I went to high school in the 80s. So, I think of, guys in the gym, dosing themselves, doping, that's not what we're talking about. We're talking about, intentional controlled medical dosages.
Well, and customized, right? Personalized to you. And one size absolutely does not fit all. It's one of my biggest issues with the influencers. I love that the conversation is coming up on social media and YouTube and all of that. And I hate that there's this perception that one size fits all, and one supplement is great for longevity and one supplement is great for whatever. It isn't.
No.
We don't look alike because we're not alike. And yes, we have a lot of similarities, but penicillin saves many people's lives and it can kill some people.
Right.
Like there's such a difference. So this personalized approach, it's interesting that we've also been taught, or I think the perception is that testosterone's main thing is libido. And I would like to, with love and from my heart, gather up every man and woman that is out there telling women who are in their 50s and 60s and 70s that they should have a high libido. And you aren't healthy and your hormones aren't healthy if you don't have a high libido. What's the purpose of libido? It's to stimulate procreation.
Right.
That's it. We're not complicated. We're animals.
We are.
We are complicated in other ways.
We are complicated animals, but we are animals.
There we go. That is the purpose of your libido. Mother Nature actually doesn't care about pleasure. It's there, it's lovely, but it's not going to be, I want to gather all those people in, all the women who've been listening to them and feeling bad because they don't have a high libido, and say, it's okay. Your libido, it may stay high, but it's absolutely natural that it goes down after childbearing years.
Yeah.
Now,
So
does that
women are even more complicated animals, right? And so
for sure.
for the most part, and we're all different, if you optimize a man's hormones, he's got, and again, different, his procreation years are way longer, too long, maybe.
Yeah.
But I know that's what I was just thinking about. They're pretty easy, right? And the doctor I work with all the time says that to people, you know, like, yeah, with a guy, we can tweak hormones and we pretty much know what we're going to get. But with a woman, how's the relationship? How are your stress levels? How is your nutrition? How is it's, you know, and how's your sleep? How's your, all of it. And so, and you're right, we're no longer need to be making babies. So,
So that's not to say that sex shouldn't be great.
It should be great, but
it should be great. It shouldn't hurt.
If you don't have energy, which is what I think of when I think of testosterone, how are you going to have a high libido when you can't get off the floor?
Exactly. And energy is the number one symptom that improves when women restore their testosterone. It's also involved in brain fog. It also stimulates your bones. It also has everything to do with your fat muscle ratio. You know, there's a lot of semaglutide, Ozempic, Wegovy, Mounjaro, and we have a nationwide telehealth weight loss with semaglutide. And so I get it. But I always tell my patients, you're not going to have as much success and you're not going to love the body you're left with if you don't optimize your hormones, including testosterone, no matter if you're a male or a woman, if you don't prioritize protein, and if you don't move your body.
You don't want to lose muscle. I mean, all of those, that's, people think they want to lose weight, and you know, and let's dive into that, because this has become such a hot topic, the semaglutide topic. So I'd love to pick your brain, because I'm sure listeners have questions, or I think at this point, everybody's heard of, whether it's Ozempic or one of the pharmaceutical brands, or the peptide world, the semaglutide. Let's talk about that a little bit, because we were talking before about, people are focused on numbers on a scale. And if you're overweight and you're not focusing on those things that you just mentioned, you're going to be losing muscle too.
Yeah.
Nobody wants that.
Weight loss.
Right. It's not a fat loss.
Not a fat loss. Exactly.
Yeah. Yeah.
So you have to do something to protect your muscle. And when you lose 20, 30, 40, 100 pounds, you don't want to look like you were in the hospital. When when you're done, you want to look fabulous and you want to feel fabulous. And they're using these medications are amazing tools. Honestly, I have never seen a medication with so much success. Never in my entire, 25 plus years, never been. And I think it will never be FDA approved for anti-aging. But there's some really interesting and profound observations in the research. A decrease in inflammation, a conversion of your white fat to brown fat. And brown fat's the scrumptious fat. It's the one with your mitochondria. A decrease in the risk of heart attack and stroke. That was FDA approved for diabetics. A decrease in the risk of Alzheimer's because of the neuroprotection. A decrease in blood glucose, we know, decrease in blood pressure, decrease in cholesterol. There's so many things that are really interesting. I think that, in my opinion, based on what I know now, I would lump it into that metformin, low dose naltrexone, There's also rapamycin, but I'm a very cautious doctor. I don't prescribe things that have yet to have clinical studies in humans. I'm old enough to remember thalidomide. I don't
Me
ever want to be the
Wow.
doctor that prescribes something new
Yeah.
that hasn't had some long-term. And that's the
Which
beautiful
is
part about semaglutide. It's been around forever.
right. And people think it's new. And let's talk about that. You touched on it already. It's not a weight loss medication. It's not fen-phen. Like this is, it was first FDA approved.
It was used in the diabetic world.
Okay.
And then as things happen, Botox was never actually used for cosmetic purposes. It was used for a condition called tic douloureux, which is a very trigeminal neuralgia is the other name. So it's a nerve pain and it's excruciatingly painful. It's called the suicide condition. People are in such pain that they literally want to die. And a gust of wind can actually make their pain start. And this Botox injections used to help the pain. And it's almost always on one side, not bilateral. Dr. Carruthers up in Vancouver, British Columbia, was looking at these patients that had the tic douloureux in their face and getting Botox and went, so happy on one side. Fast forward, we studied it. Same as the lash stuff. It wasn't cosmetic purpose. It's a glaucoma.
It's a happy side effect.
This medication was being given to diabetics, and all of a sudden there's this notice that they're losing weight. Now everybody's like, well, every diabetic when they get treated loses weight. No. If you take insulin, you don't necessarily lose weight. You might actually gain weight. Metformin may or may not get you, the glipizide, all of it. I mean, there's so many medications, and it wasn't associated with its weight loss. So that did start an FDA-approved clinical trial for one brand that did this of the medication. The generic active medication is called semaglutide, but the one brand did do a weight loss study, and they found that 88% of patients lost, I think it's 15% of their body weight.
Wow.
And unfortunately, they didn't do, make sure you eat protein and optimize your testosterone and all of that. It was weight loss.
Right.
So yeah, you're right. It's a weight loss medication, but
right. Right. And so because it is such a craze, I think, and it does have so many potentially positive benefits and uses. I'd love to talk about, who's not a good candidate, or I guess I have seen it used what I think is properly with remarkable results to help somebody's long-term health and wellness. But I'm always afraid of, the people that aren't going to change lifestyle. And that's first it was this big, like everybody loved it. And then it was like, oh, but be careful, because if you stop, you put the weight back on. And it's like, well, change. Yeah.
Can we just pause there? Duh.
Right.
If you go back to sitting on the couch and eating bonbons, of course you're going to get the weight back.
I don't know. Like, how is this a surprise to anybody? Like, how did you get that weight to begin with?
It's a user failure, not a medication
failure.
Right.
Or a practitioner failure.
Yeah. There's so many doctors write a prescription. There is a list of contraindications, and then off you go and call them if you have any problems. At our clinic, you get your labs and hormones evaluated. You have a scheduled appointment every month and unlimited support, meaning if you wanted an appointment every day, you could have it.
Right.
It's no extra charge. So the support and the education and the coaching and telling people how to lose weight healthfully is not always being done with this medication.
And that's the gold. To me, the medication is a tool to help people make those changes more easily and have them be sustainable. And then I think like, wow, again, the best of both worlds, right?
Yeah. And the cool thing is that phrase that you just used, it's a tool, is perfect, because the mechanism of action is that it makes you feel full longer. How does it do that? Well, it slows the gastric emptying, so you literally are full for
Right.
longer.
Right.
And if you try and eat more, you'll feel sick.
Yeah.
But it also acts in the satiety center of our brain, and it makes us feel satisfied. And if you think about it, we always have times in our life when we eat because we're not satisfied, but we are full. Thanksgiving. How full are you? And then there's pumpkin, and it's because
hopefully
you want that.
Paleo. No, I'm kidding.
Well,
in my house it is.
pecan crust. So having that satiety center feel satisfied. I mean, my patients say, can I take this forever? This is the first time I'm in charge. The food chatter,
that's a big one.
Yeah, it goes away, or it gets so quiet that you can tell it, shh.
Right.
You're not in charge.
Yeah.
Thank you, but no thank you. And so then when you've got, a cookie or some protein in front of you, you can choose the protein.
Yeah.
Now, I'm of the 80-20 rule. I feel like if 80% of what goes in our mouth feeds our cells, 20% can feed our satisfaction. And probably because I have such a sweet tooth.
Well, and I say this all the time, like the deprivation is not the key to long-term happiness or success.
It's like holding your breath.
Yeah. What happens when you change lifestyle, I think that 80 and 20 cross over, right? Then you find the paleo pumpkin pie instead of there are ways to still make something nourish your cells and make you feel like you had a treat, for sure.
Well, and if you stop eating all the processed foods, a tomato actually starts to taste different.
Yes. I had a client ask me, I'm not kidding, I couldn't make it up, and she was serious. Did strawberries always used to be this sweet? Like, yes, they're supposed to be dessert. Yeah. It's so fun.
It's a great tool. I kind of feel like it's a little bit like the nicotine patch for people who are trying to quit smoking. You take away that nicotine cellular craving. So the semaglutide is taking away the appetite and that craving for sweets, craving for food, craving for alcohol, believe it or not.
Yes, which is tremendous. And I think kind of a happy side effect to the happy side effect is like this trickle down. I've heard it in so many ways, from people who rarely drink and now don't drink to people who would drink often and they're just not interested. It's fantastic.
Remarkable. I bet you they're going to study that and get it approved.
They need to. Yeah. It's remarkable.
So it's amazing. A great tool, I think, that used in the right hands. If you go to a pharmacy with a prescription and your insurance doesn't pay for it, and let's face it, insurance doesn't pay for it unless you're sick. So if you're a diabetic and if you're heavy enough to be a candidate for bypass, your gastric surgery, then it'll probably cover it. But if you're trying to be healthier and lose some weight so you don't get diabetes.
Right. Preventative?
No, they only pay for conditions and diseases that exist that have a ICD-10 code, and wellness doesn't have a code. So you'll go to the pharmacy and you'll pay anywhere from $1,000 to $1,800 for a 1 month supply. Yeah. And the beautiful thing is that this medication is available in its generic form from compounding pharmacies. Yeah. For a fraction of the price. Like our patients pay $389 a month for their medication. Yeah. And they pay $99 for unlimited medical support and monthly appointments. So and the beauty have to break the bank.
Well, and the beauty with one of the things I like about that, again, is that individuality. So you're not getting a unidose pen or when you're getting it compounded, we have people work up, and whatever your effective dose, like stop there. You don't have to, there's no goal. There's
no, right?
Yeah.
Well, it's to the pharmacies or the pharmaceutical companies' advantage to have a 2.4 milligram preloaded pen. And the vast majority of my patients are on 1 milligram.
Yeah.
And if we need to, we go up.
You have room to bump.
But why would you use more if you don't have to?
Yeah.
Just as lining the pharmacy pocket.
I happen to be wearing a green shirt today. I don't know. Is that the answer?
Maybe it's pink.
Yeah. No, it is. And some, the way the system still is right now, sometimes we have to step out of that model and find the other option. And this is one where I think it's a better option because it puts the control into our hands as far as, we can find that optimal lowest dose and not just go through as much so they can make more and make more money.
Yeah. And it's important. Not all compounding pharmacies are created equal, but
Sure.
As soon as a compounding pharmacy is able to dispense a sterile injectable medication, they have to have a special certification, and it's called PCAB, and it's a similar certification to a regular pharmacy. So it's not this random.
It's not some guy in a garage.
Yeah. So
Yeah.
PCAB certification is something that you can ask, you can check, and make sure that you're getting the stuff from a company that is holding themselves to the highest standard, and a doctor who will only prescribe at PCAB.
Right. Yeah. And that's, again, falls to us to, find those providers we trust. And I always say, we were trained back then, since I remember thalidomide as well, trained to be respectful and listen to the doctor, and trust your gut. If you don't have the right doctor, find the right doctor. But this
you can fire your doctor.
Absolutely. Yeah. Absolutely. So you touched on some of it, but who is not, in your opinion, who is not a good candidate for
there's a list of very clearly defined that, if you just look on
contraindications,
that are contraindicated,
and then
thyroid cancer and some medications that you can't, but pancreatitis, a history of pancreatitis. We have a our rule is that if you are planning to get pregnant within the next 6 months, that you can't take this if you're breastfeeding. And the reason is because we don't know.
Right.
And so the answer is no, unless we know.
I like that. I like that. That's amazing. And you did touch on I would imagine it's back to the soil idea. Like if your whole goal is to just get back on the couch eating your bonbons, this is not the answer for you.
No, and with a monthly appointment, and you get your labs and your hormones analyzed. A lot of our patients are in perimenopause and menopause. Of course, this medication is actually approved for 14 and up. Did you know that? 14.
I did not know that. That's amazing. Wow.
So there's a lot of controversy about kids using this medication. And again, I think that with counseling added and nutrition and exercise, that this can be a leg up for these kids to not become diabetic, to not become insulin resistant, to have confidence in how they look and how they move, and to be able to exercise more. So I don't prescribe it quickly, but you can as young as 14. What we don't do is we don't prescribe the patients that are size 6 so they can be a size 5.
I'm glad you hit on that, because that's part of this whole kind of influencer craze as well. And so, this is not, I was on vacation. Now I want to, get back into my skinny jeans. Yeah, this is not the morning after pill for a bad decision out.
Dieting.
Love that. That's
amazing.
So I'm experimenting myself. Like I said, I'm not a super courageous doctor. I don't prescribe things that haven't been around for a while. But this medication has, and given all the anti-aging benefits, I do not need. I'm genetically tall and thin, so I would not need to use this for weight loss. But I use it in a micro dose once a month. Do I know that I will get the same positive benefits that have been found when people are using it at a therapeutic dose every week? No. But do I know that taking a lower dose less often is safe? Yeah.
Right.
Unless I get side effects. So there's lots of ways to use this.
Yeah, I'm excited. And I think this is like the tip of the iceberg. I really do think it is going to follow that similar path to like a metformin or LDN. I would say metformin's further ahead on the curve than LDN. Some, people, anyway, that's a whole nother episode.
Right.
I would like to publicly on air invite you back because I really want to talk about frequency and energy. And I think that needs its own episode. And so we have witnesses. I would love for you to come back and
I would be honored.
Share with us.
And there's a lot to dive into. And guess what? There's a lot of research now.
Yes.
It's not woo-woo anymore.
Yeah. Yeah, no, and I love that everything that used to seem so woo-woo is really just science, and we've known it. People have known, not personally, but humans have known these things for thousands of years, and we've circled back to so please come share with us.
Thank you.
So before I give you your day back, I would love to know one step that listeners can take today to start to move the needle to improve their health.
Well, this is a great segue into our next episode, because the most powerful tool that you have, regardless of a prescription, a doctor, a health coach, or yourself, the most powerful tool that you can have to move the needle in your own health and your own life is to meditate.
I'm going to ask you a follow-up, because you did the one thing. Everybody has trouble doing one thing. They'll say, but my follow-up is there a particular way or kind or amount?
Yes, the one you'll do.
Yes, good answer. I didn't even plant that one.
Because sometimes, and you should have more than one in your tickle trunk.
Yep.
Sometimes my brain just will not shut up.
Yeah.
And I have to do a guided meditation.
Yep.
Other times, the guided meditation voice, I just want to throw it across the room.
Yep.
So it's like exercise. What's the best exercise? The one you'll do.
Yeah, I love that. Dr. Tami, before we wrap up, where's the best place for listeners to find you? If they're, I listen on the go, and that's why I throw this question in there, because I'm not always good at checking show notes.
Yeah. I'd be honored to talk to anyone. We are accepting new patients at my clinic called BioThrive for hormone optimization, functional medicine, and our weight loss. The website is biothrivelife.com. And you can email us at support@drtami.com.
Amazing. Thank you so much. Incredible gold. And obviously I have so much more I want to ask. So hopefully we'll get it done soon.
Well, thank you for having me. It was a real pleasure. Have a beautiful day.
You as well. And for everyone listening, remember, you can get the transcripts and show notes by visiting inspiredliving.show. I hope you enjoyed this episode as much as I did. Have a great day. See you next week.
Thank you for listening to Julie Michelson's Inspired Living with Autoimmunity. Did you enjoy this episode? Please like, share, and subscribe wherever you listen to podcasts. If you'd like to get a transcript of this and every other episode, just head on over to inspiredliving.show or click on the link in this episode's description. There, you can also find everything we discussed in this episode, including links and information about our guest. You can even send in your questions to be answered by Julie in a future episode.
That's inspiredliving.show. Until next time, this is Julie Michelson's Inspired Living with Autoimmunity podcast, helping you take your power back.